following the second package, which is with the herbal medication, the first page, but we got to skip 4 pages, and we left on the question number 6, 20 weeks pregnant, most concerned. There was answer butterfly rashes. Now you do see butterfly rashes in other infectious disease. What is that disease is, and second, but is normal in the pregnancy, and it's called chloasma. Remember, the pregnancy changes the phase. Uterus palpable is the level of symphysis pubis. This is the answer, is correct answer. And most concerned, that means you're looking for a wrong answer. Where is the uterus you will do palpation would be at this time 16 weeks. So write down 16 weeks. You are able to palpate the fundus, and it should be around symphysis pubis. So this is more concerned. 20 weeks should be at umbilicus area. So I want you guys to write down fundal height. We use the word fundal height. So when we are saying fundal height should be 16 weeks at the symphysis pubis. So write down where we left it on question number 6. That was the wrong answer we marked. And so B is a wrong answer. And they're saying, what is your concern about 20 weeks? So 20 weeks, the fundal height should be where? At umbilicus area. 16 weeks is not correct answer. So it should be at 16 weeks. 20 weeks, it should be right down umbilicus area. Serous fluid drained from the breast is your breast milk, so that's normal. And breast engorgement or enlargement and heaviness is normal. So the best answer was here, was number B. So everyone remember fundal height. Okay, that's a fundal height. Now number 8, we did metal piece if in the eyes. Now you cover both eyes. Number B was the answer, number 8. But covered loosely. Always remember loose, don't put too pressure. Wherever the word compression, don't use that. Maybe a cup they can give you. Cerebral angiogram is when they are done. All angiogram, you're using the dye. So what do you do after the procedure? Give them fluid. So number A is answer. Number 10, we also did using clean or non-sterile gloves care is appropriate. Yes, for washing genital area. When you're cleaning, you're not using a sterile glove. So it's a clean procedure. Yes, so put the answer. Yes. Now leave this page. And if you guys move on the next page, you leave that because it's all repeat question. And we have already done. And next page also we have done. So keep moving. And also the next page we have done. So you skip 2 pages, and now I want you to go next page where it says if you have aid is immunocompromised on the back. So everyone get that page before I move on. So keep moving 2 pages, and then on the 3rd page you're going to see if you are with the aid and you are uncompromised. Avoid crowd. We always did this question. So whenever you have aid, because their resistance is low, you do not want them to be with infection. Now skip 2-3 line and go priority question. See what kind of questions you're getting in the exam. Priority question. Which of the following clients should the nurse deal first? Underline that. First, which patient? A client who need daily vitamin, a client who need to be suctioned, client need to change diaper, or a client who is being prepared for discharge. So when you are coming in a priority, A, B, C. So number B, you will go for suction. So remember, suction, A, B, C, airway, breathing, circulation. Write down there also suction where you have answer. Write down pulse oximetry. Always read the word pulse oximetry. They're looking for respiratory. If your pulse oximetry is not normal, are we clear? 90, less than 95, 60, 70, that's bad. Also write down the word tachypnea. Whenever you have tachypnea word, that means your patient respiration rate is high. And that means they are suffering for airway and oxygenation. So your priority, discharge in some question, maybe discharge is your priority to do your patient first. But what is priority here? When you have airway, you pick up airway. Are we clear? So that's second is the answer. So it says correct answer is number 2, who need to be suctioned. Now number 2, I'm going to move on delegation. So everyone, you're going to see question in Nclex is priority. Are we clear? So what are the priority? We said airway. Maybe I want you to write down on the side, is admission, maybe your priority. Discharge, maybe your priority. Patient who's going for surgery, maybe your priority. Patient who fell, that may be your priority. But yes, ABC is one of the questions. But if you don't have ABC and your patient is admitted, aren't you going to see that patient first? Yes. If your patient is discharging today, that may be your priority. Patient fell this morning, may be your priority. Are we clear? So priority is very important. Then I will move on, delegation. In delegation question, we all know RN and LVN and UAP and CNA. Which of the following clients should LPN to be assigned? Number 1, newly diagnosed with myasthenia crisis. What is myasthenia crisis? Acute. You don't take it LVN if they're comparing with RN. What is myasthenia crisis? They cannot breathe. Are we clear? Crisis means, write down the word excavation. Excavation means is they very acute. So when you have excavation word, crisis word, acute word, you do not take as a LVN. RN should take care of the patient. Then number B is you're going to immediate post-operative patient. Somebody come back from surgery, may be unstable. Number 3, a patient who's awaiting for vitamin medication. Yes, they're stable, they need the medication. Number 3 is the answer. Newly admission diagnosed with kidney transplant. Don't give them kidney transplant. Why? That's acute patients. Are we clear? Everyone understand which patient are you going to take it if you're comparing between the RN and the LVN. Are we clear? So which patient are you going to take it? I will give you this. Keep it in case somebody needs the package. So I have few of them here. So next is on your question was number 3. Waiting for medication. Correct answer is number 3, stable patient. Everyone is okay? Don't take acute patient, don't take patient who's really coming back from surgery. Even you can take care, but in between RN and you let the RN take care. Next is delegation. Remember 5R. What is 5R there? Right task, right person, right circumstances, and right communication and right feedback. And RN, least stable means unstable patient, RN should take. Hickman catheter, RN should take. Admission, RN should take. Discharge, RN should take. Health teaching, RN should take. Transfer or blood, when you're giving blood transfusion, 2 RNs should be always involved, even when you're checking 2 RN. So very important that you know what RN can take. LVN can take very stable patients. Medication, you can do it. Wound care, you can do it. CNA, routine care. Now, I don't agree a lot of your urine deep stick, the urine test, in the urine testing, you can do it. Report RN, you can report it. It's vital sign. I want you to write down for CNA. Bathing, they can bathe. Ambulation, bed making, feeding, stable patient. They can feed. So any patient who cannot feed themselves with a problem with dysphagia, don't give CNA. But if a normal patient who's a chronic, they can feed them. Vital sign, chronic patients, remember, always remember, if there is a acute word, then vital sign should be done by LVN. All right? Now, next is, you will go UAP, is group activity, ambulation, turning, they can do it. They can also, stable patient, help in bathing. Stable patient, they can help in also vital signs. So very stable patient, you give UAP. We all know what is UAP. Untrained is your CNA. They're not having license. CNA are certified. UAP, they're not certified. But they're using them to help in the hospital. So all these informations are important. Now room assignment. Go in the bottom in room assignment. Who to share room with? Questions are going to be, how do you do your room sharing? Number one, always keep in mind age group and sex. What age group you have. And B is A, B, C, D, E. B means, are you going to put somebody in close to nurse's station, end of the hallway, single room, or in the private room? C, infection, chain of infection. What kind of infection do they have? Who you can put together? Are we clear? Now always remember, airborne, you don't put it with droplet. Droplet to droplet, you can keep them. Contact patients, you can put two together, that's fine. So always see what are you going to keep together. And diagnosis, always keep in mind the name of they're going to give you diagnosis. Patient has this diagnosis. So they may not be saying the infection diagnosis. Patient has meningitis. Are we clear? Patient has TB. So what diagnosis do they have and what diagnosis? And some they're giving with the infection. Environment. What kind of environment? Quiet environment. For which patient? You're putting them in a quiet environment or a cold environment. Are you going to put your hyperthyroid patient, grave disease, in a quiet environment? Yes. Why? Because they are hyper and they don't get along. Are you going to put them alone in the room? Yes. So hyperthyroid patient. What are the other patients, do you remember? Anybody with ICP? Are you going to put them in a quiet room? Yes. ICP patients. Meningitis patients. Yes. Are you going to put patient in quiet room? Yes. Hypertension patients. All your hypertension. You want to control their blood pressure. You want to put them in a quiet room. Are we clear? Some room you may have dark room, quiet room, no noise. What about phenochromoscytoma? I want you to write down. Everyone remembers. Sometimes we forget. But if you memorize that even you have hyperthyroid patient goes in a alone room because they are hyper and they are extremely agitated. So some patients with behavior, schizophrenia patients, you want to put them alone. Why? Because they're very active and maybe they don't get along. So remember, room assignment. We are nurses and they're going to give you are getting a patient and what room, and you have these 5 patients who they can share the room. So don't be surprised. These are your question assignment, visiting first, RN, LVN, and CNA, your delegation. Next page, if you will go on the other side. So this is on your assignment, sample test. The best roommate for patient with leukemia. Now they gave you diagnosis. They're not saying what infection, but you should know what is in leukemia. What is leukemia? Do we remember what is leukemia? Bone marrow cancer. So what happened? The risk for infection. Next is 9 years old with ruptured appendix. What is appendix rupture can lead to? Infection, peritonitis. Are you going to put with that? If they didn't give you peritonitis and they're saying ruptured appendix, that means they already are going to have infection. They're looking your knowledge. Number B, chicken pox. Can you put with chicken pox leukemia? No. Chicken pox goes in airborne. Number 3 is 2 years old with fever of unknown origin. They have fever. Are you going to put them with that? No. Number 4, nephrotic syndrome. What is nephrotic syndrome? I have covered that. And what is nephrotic syndrome in the babies? And what is a nephrotic syndrome we have here is, remember, is a kidney problem. If I remind you, kidney problem, but what are they are having? Infection. Why? The risk for infection because they're taking a steroids. So they're checking your knowledge. Nephrotic syndrome really don't need isolation, but they are also risk for infection. So can you put both of them together? Yes. So your patient would be number 4, Correct answer is number 4. A, 5 years old with nephrotic syndrome, you can share with leukemia. And Y, number 1, 2, 3, has infection. Leukemia is immunocompromised infection, and since patient with nephrotic syndrome is on diuretics, underline that, and steroids. When I did nephrotic syndrome, I explained that. It's up to you how you're remembering. If you don't remember, because they're on steroids, they're also risk for infection. So they both can be together. See how your questions are? They're not going to give you is what we are. You can check with him what page we are on, so you can find it, okay? And it's the second page, we are the second package, and so make sure you guys know. And room assignment and correct answer would be nephrotic syndrome. Infection control, number 3, we did already. Number 3 is method for RN utilized patient with salmonella. Highlight the word salmonella. I did already in 2 pages. It's a repeat question. What is salmonella? Number 4, enteric precaution. What is enteric precaution? You got to memorize is contact. So write down on the side is a contact precaution. And what do you do in a contact precaution? It comes, whenever you see the word enteric, write down GI. What does GI mean? Diarrhea. And so they didn't give you here disease, and they are just giving you salmonella infection. So salmonella causes GI diarrhea. And so what do? Highlight the word hand washing. Yes, you got to wash your hands. You got to wear the gloves. You got to wear the gowns. 3 things. We are the second pages, and we are on where we have some questions, where we left it, so keep moving on that. Infection control, salmonella we did, so everyone is okay. Source of infection, food and water. So remember, any food and water, enteric precautions are with that. Transmission-based precaution, I gave you the page. Everyone should memorize your airborne precaution. And airborne precautions, you have TB, you have chicken pox, and you have, what was the other one? What was the third one in airborne? Herpes zoster, remember herpes zoster. So that's also in your airborne. So everyone, you guys need to know. And airborne, small particles, MTB, which is okay, and varicella is okay, chickenpox is okay, airborne. Contact, drug-resistant organism. What is drug-resistant organism? MRSA and VRE, that goes in contact. Droplet is, you're going a lot of them in droplet. Droplet is more on your precaution. Then you have enteric precaution. So I gave you the pages, and I want everyone to know your airborne, droplet, contact, and reverse isolation. Everyone remember, what is the pressure you have in airborne precaution? What kind of pressure are you going to put your patient in? Negative. Are we clear? And where do you apply positive? In reverse isolation. There is only 2 pressure, negative and positive. So you guys need to make sure you're not going to get by if you don't know the word salmonella word, enteric, and what else comes in contact also? Your C. diff. All your GI, all your eye infection, all your skin infection goes where? In contact precaution. Okay. Age appropriate, so those are reminder. We have already talked about it. So if you go and take exam and you are not sure your precaution, don't think you will make it. I want you guys, make sure you memorize. If you do need help before I leave, I can review that, but you guys have to know that. Age appropriate growth and development. You got to know growth and development, normal. And what do they kind of play they are, and what growth they have. Which of the following is not, underline the word not, in preschool? What is this not in preschool? Number 1, answer, parallel play. Where is the parallel play? Go in the bottom of the page. It says in toddler. Are we clear? Now they can balance foot and eye closed. They can do that. They can skip and they can four jump rope. So those are correct answer. Which is it preschool does not have is your parallel play. Parallel play is only in who? In the toddler. So let's move on to the, so remember, I told you guys, you got to know all the growth and development and this, because that is very high in Nclex. Next page, you move on and they are telling you motor development. All they explain about 4 years of age. They can hope, skip on 5 years of age. And play, what kind of play they have preschool? Associate, underline, imaginary play, associate play. And they are afraid, preschool child, you're admitting, when you're admitting, they're afraid of venopuncture, IV, injection, body word, underline the word, intrusive procedure. Intrusive procedure and body mutilation. You got to skip the next page, and on the top of the next page, they are explaining about what is common in 4 years old child. And what do you look in preschool child, and they explain here. Now I will move on where it says the word toxoplasmosis. Now where do you have toxoplasmosis is in OB question. What infection the mother can get it during pregnancy? One of them is toxoplasmosis infection. And how do you get it? Underline the word. In which following pregnant client is risk for toxoplasmosis? Now what are the reasons to get the mother toxoplasmosis? Number 1, number 2, and number 3 are the correct answer. Eating raw meat, underline that. Infected cat litter. And number 3, any soil exposed to cat feces. So 2 words we remember. Toxoplasmosis is common infection in the pregnancy if mother is coming in contact with a BM, with the feces and with the cat feces and the raw meat. And so correct answer 1, 2, 3. Now I want you to go underline the word, how do people get toxoplasmosis? Accidentally swallowing cat feces or infected cat shedding the organism in the feces. And third line, cleaning of cat's litter. And skip 1 line, eating contaminated raw or partially cooked meat. Then skip 2 line, and then you go contaminated food with knife, utensils, and cutting board, and raw meat, and drinking water with toxoplasmosis. So everyone should know that the mother can get infection from cat litter and meat and contamination. Now, so you got to enforce teaching to prevent it, because the babies do get infection and it can cause congenital defect in the babies. Are we clear? So, and maybe mother can have abortion. She can lose the baby. Which of the following is incorrect if the nurse has a goal of, underline the word, reinforce. Everyone, they use this word common in the exam. Reinforce word is what? You keep teaching them, reinforcing. That means it's a good teaching. And what do you reinforce your patient? Take your medication, drink water. Are we clear? So reinforce word is you got to do. And in a information about the cancer to a group of young adult. I told you guys cancer is very important for Nclex. And I did in the other chapter. And I told you, and you guys wrote it down, the reason for cancers are, number 1 is your answer. Can reduce for stomach cancer by eating a lot of fruits and vegetables. All your cancer, how do you prevent them? By eating what is your more fruits and vegetable. Limit the meat. What meat do you cut down to cut down the cancer? Red meat. Are we clear? And what kind of vegetables are, remember I told you? Flower vegetable, cruciferous vegetable, like broccoli and cauliflower. Are we clear? And also is avoid nitrate. Any chemicals, nitrates are not good. Chemicals you're adding in the food are not good. So very important. And also I want you to add that, cut down the fat. So everyone should know, fat is not good for your cardiac and for your cancer. So cancer, question, cut down fat. Which age group cancer is common? Older people in your teaching question. So which group are you going to teach prevention of cancer? More in all older people for breast cancer, colon cancer. But yes, diet is very important for all cancer. Cut down fat. We need to eat more vegetable. Cut down nitrates. Cut down the chemicals in the food. More organic food. Now, a lot of people, we are looking more to eat more organic food. Are we clear? So that goes. Everyone should know the reason for cancer. Everyone should know how do you get the cancer, breast cancer, cervical cancer, colon cancer, breast cancer, and how do you prevent them? Your questions are going to be in Nclex. Next, on the other side of the page are, you got to memorize tonometer. I said tonometer for glaucoma patients. And what do you monitor? Normal pressure till 21 to 22 is okay. More than 22 patient has glaucoma. What fluid is building up here? What fluid is building up in glaucoma? Aqueous humor. And what does the glaucoma lead to? What does lead to glaucoma? Blindness. So what do you teach your patient to prevent glaucoma? Put their eye drops. If they're not putting their eye drops, then they're not going to get better. What kind of eye drops do we use for glaucoma patients? What is the eye drops are? Miotic. Are we clear? What is miotic does? Constrict the eye. Now PR interval goes in the cardiac. Serum amylase. Now these are, you guys have to memorize. Serum amylase is a blood test. And which patient are you going to do amylase and lipase? Which patient are you looking amylase? It's pancreatic enzyme, pancreatitis, right down there. If that is high, that means your patient has pancreatitis. Ammonia level. Which patient are you checking ammonia level? Liver cirrhosis, right down there. At least you got to memorize the level, and you should know ammonia level is high, lipase is high. Calcium is very important. And where do you get calcium? We all remember, and we talked about it. What gland is producing your calcium? Parathyroid gland. How do you cut down your loss of calcium? What is important in teaching for calcium? What do you quit? What is causing poor absorption of calcium? Smoking, alcohol, caffeine. In your teaching, we are teaching more to the patient to prevent from absorption of calcium. And parathyroid gland. Calcium is very high in Nclex, and we all know low calcium comes from what gland? Hypoparathyroid. What test do you do for calcium? What test do we do to confirm patient has low calcium? Remember, Chovastic and trouser sign. We all should know. Low calcium. So what is the biggest problem with low calcium? Remember the word? Your muscles weakness. And the word is called technique. You got to memorize. You got to, in your question, immediately to pick up your answer. I want you to know your prothrombin plastine time, then your PTT time. Platelet, very important. What is if your platelet count is low? Less than 150,000, if 20,000, 10,000, the risk for bleeding. What is the word is called? What is the word is called? When your low platelet count, thrombocytopenia. They may not give low platelet count, and they said, your patient is admitted with thrombocytopenia. So I want you guys remember, as soon as you know the wording, in a lot of wording they're using, name of diseases. And if they give you somebody with thrombocytopenia, there's no problem with the infection, but the risk for bleeding. Maybe your answer to apply pressure after you give injection. Maybe you prevent them constipation. Why? If you're pushing, they're going to bleed. See, the questions are not apply pressure, may not be question is bleeding, but what would you do as a nurse if your patient is risk for bleeding? Are we clear? So you got to think, critical thinking. This exam is all critical thinking. Albumin level. What is albumin? What is albumin? Protein. Write down the word. if you have low albumin level, what would be the problem in your patient? What would be albumin can lead to ascites, but more than that, if you have a wound care, your patient is not going to heal. What do you need more in your body to heal? Protein. Very important for decubitus patient. We do albumin level. You don't get any treatment covered unless your albumin level shows this patient really is risk for poor wound healing. Are we clear? Everyone remember, what do you give in wound healing question? Write down protein and zinc and vitamin C. Everyone, we are nurses, we all should know. You got to increase protein, you got to increase zinc, you got to increase vitamin C. Are we clear? And those are your questions. Next is, if you don't know osmolarity, that's okay. Suction, very important. The pressure of your suction, infant, child, adult, 100 to 120 pressure gauge. You have to have normal safe suction range. Very important. Now, you guys have this information and you must review. I'll tell you that this is all based on your questions. Are we clear? So, suction you should know, calcium you should know, thrombocytopenia word is important. Now, next page, I will move on, is lithium. Lithium level is 1 to 1.5 is your lithium level. Dilantin, and where do we give lithium level? Where do we give lithium? Bipolar patients, right down there. What do you teach them when they're taking lithium? Salt and water. Don't cut down salt and water. They need to take enough salt and increase fluid. If your patient has more than 1.5, that means is what? Patient has high level. What would be the sign and symptom for your patient toxicity? Diarrhea and ataxia, weakness. You got to know if your patient has toxicity with lithium, what can happen? Dilantin. Why do we give dilantin? Seizure medication, 10 to 20. What is the toxicity of dilantin? What is the toxicity of dilantin? Gum bleeding. Remember? Hyperplasia of gum. I want every minute you memorize. These are common drugs. Also, all your seizure medication makes your patient CNS depression. Write down the word seizure medication, CNS depression, and they're very drowsy. Your patients are very drowsiness. Are we clear? And digoxin, what is your normal dig level? 0.5 or 0.8 to 2.0. More than 2.0, your patient is having toxicity. What is the early sign of digoxin toxicity? What is the early sign of digoxin toxicity? You guys, we got to memorize. Anorexia. And they're not eating. Nausea and vomiting. What are the other signs of digoxin toxicity? Visual. Halos around the eyes. Lower pulse rate. And affect your potassium. I want you guys add there low potassium. These are common symptoms we must know for exam. So please memorize. I know it's not easy, but you got to know your digoxin, lithium, and these what I'm doing in these packages very important. And you have a lot of them, same thing we've done, but a lot of things are more here. What are your questions based on? Okay. Now next is, I will say magnesium sulfate. Where do you give magnesium sulfate? Where do we use? Preeclampsia mother. And remember, magnesium also affects the muscle. And what is the toxicity of magnesium? So normal level is you can keep it up to 8 mg. For pregnancy, you're giving magnesium sulfate. And why do you give magnesium sulfate? To prevent mother from seizure. Write down preeclampsia mother. And you're preventing seizure. If it is more than 8, what happened? What is toxicity of magnesium sulfate? I want you guys to write down absence of DTR, deep tendon reflexes, absence of DTR, deep tendon reflexes, and then I want you to write down it lowers the respiratory rate and lower the urine output. So 3 sign and symptom we all must know in OB question. What do you monitor the mother when you're giving these drugs, magnesium sulfate in OB, and number 1, absence of DTR. Are we clear? Number 2, low urinary output, less than 30 ml, and your heart rate, the respiration is depressing. That means going low. And what is your normal level? 8. But if it goes more than 8, 10, 11, and 12, that is toxicity of your magnesium sulfate. What do you give in your question if mother has eclampsia? What is word eclampsia? Seizure. What medication you give? Same, magnesium sulfate. So remember both. Pregnancy temperature. Slight elevated temperature is okay. Normal white blood count. So this is a normal temperature in the pregnancy. And it may be slight, 99.6. BMR rate is increasing, that's why. And white blood count is higher, is normal, 11 to 15,000 immediately post-operative care. So sometimes the mothers, when they had the babies, the white blood count is higher, is normal. Are we clear? Next is stomach capacity, how much the baby can hold in the stomach. Is newborn 10 to 20 ml, 1 week 30 to 60, 2, 3, 1 month baby 90 to 150 ml is the capacity. Are we clear? So some question you never know, they're looking in normal growth and development, and that's the capacity. And next is left atrial pressure and fibrinogen level. Very important, we all know fibrinogen is for clotting. Fibrinogen is for clotting. Normal is 80 to 180 to 340. Female you have. But when you have, go underneath, it says disseminated intravascular coagulation, fibrinogen level drop. Highlight that word. So if they give you, your patient is admitted with DIC, what would you see in the test? Their fibrinogen level is low. And that is why they're bleeding. So which patient are you going to see? DIC, remember, write down the word. I have covered in Spider-Man, I have covered in the last pages, and DIC can be in your med-search question, OB question, when there is a bleeding problem, which is the mother you will find in OB question, is abruptio placenta, complication of abruptio placenta. Liver cirrhosis patient can, liver problem. Septicemia, when you have infection, and write down the word secondary. And so what test do you do in your question when a patient has or mother has a DIC fibrinogen level? What medication do you give them? Write down the word heparin. You've got to give them heparin. So you've got to connect your question. Next is, I will go over a little bit your regular insulin. Everyone should know your insulin. And insulin regular, NPH, then you have Humulin, and slow-acting ultra-lengthy, and then you have combination insulin. When you see 70-30, that means they are combined with fast-acting insulin with that. So regular insulin, everyone should know, peak is what? 2 to 4 hours. Very important, 2 to 4 hours. So write down there, if you give regular insulin, 8 o'clock, your patient hypoglycemia, you will pick up 10 a.m. So write down peak. Peak is a different word. What is a peak? Then your answer would be 2 to 4. But what is hypoglycemia? Your patient would be, then you pick up 8 o'clock you gave, 10 o'clock means 2 to 4 you pick up the first answer. Are we clear? So there is 2 wording in your question. Maybe they will ask you what is the peak of your regular insulin, then you will say 2 to 4 hours. That's the peak when your patient is going in hypoglycemia. But what is the hypoglycemic? You will monitor your patient just immediately after 2 hours. Same thing with NPH. Peak is 6 to 12. So you will go 6 hours. So it comes around 3 p.m., 3:30, 2 o'clock maybe, and around 7:30. After 7:30, in between this time, your patient is already hypoglycemic. So you got to read your question. NPH is a cloudy insulin. Everyone is okay? Regular is your clear insulin. Now slow acting will take peak 8 to 20 hours. And when do you give food for your patient with regular insulin? When do you give, after you give insulin, when do you give your tray for your patient in regular insulin? Very important, 30 minutes. Are we clear? Within 30 minutes, your patient should eat their meal. Now, next is your mixed insulin, and their peak is 2 to 12 hours. Because 2 hours, why? Because they're mixed with the fast-acting insulin, with your other insulin. Now, central venous pressure, you already talked about it. What do you monitor in central venous pressure? Underline the word fluid. If it is more than 11, is too much of fluid. And what is normal? 3 to 11. 3 means if they're less than 3, that means it's not good. If it is more than 11, that means too much of fluid. What is another word they can throw the wording for CVP is fluid volume or blood volume. So what are you measuring here? The blood volume or the fluid volume. Next is electrolytes. I want everyone to know your electrolytes are sodium, potassium, calcium, magnesium. Normal, very important, your calcium, your potassium, and all your levels. Then you have something with the cardiac. If you can memorize, that's fine. If not, but yes, you must know your electrolytes, CVP line, your insulins are important. Now, on the other side of page is you have ammonia level. We already talked about amylase. Underline the word amylase and lipase. Lipase also for pancreas. It's a pancreatic enzyme. Cholesterol, all these are cholesterol, LDL, HDL, and triglyceride. Should be less than 200 triglyceride. So if your cholesterol level triglyceride is, and total cholesterol, same, if you go 140 to 199. If it is more than 199, then your risk for heart problem. So this is important, LDL, HDL, and triglyceride for your cardiac. Bilirubin. Which patient are you looking for bilirubin? Your liver, your pancreas, and gallbladder. What is bilirubin is for showing sign of jaundice. So write down there, sign of jaundice. Now uric acid. We all should know uric acid goes for what? For gout patient. Write down the gout patient. And what do you increase for uric acid? Gout patient, fluid. Increase fluid. What food are you going to give? What do you cut down here? Purine, right? In their diet. Your organ meats are very high. So purine diet, it's a diet question. You're going to get it. Uric acid is high and it causes inflammation to the joints, right? And where does it affect? Gout is affecting the kidneys, not only for the joint, but you got to monitor kidneys. Are we clear? Why you're taking out the uric acid through the kidney? So what does it damages? Gout is kidneys problem. So you got to monitor renal failure. So write down on the side. Hemoglobin A1C for diabetic patient. Write down diabetic patient blood test. When do you do the blood test? 3 to 4 months. One every 3 months. Every 4 months, the doctor should check hemoglobin A1C. Creatinine level for your kidney, BUN and creatinine, very important. Serum creatinine 0.6 to 1.3. If your creatinine level is high, what does it mean? Your kidneys are affected. And which patient you will monitor when you're giving medication? Remember, I told you the drugs, very important for your Nclex. Aminoglucosides. Amino, write down the word glucosides. What is aminoglucosides are? mycin, all your drug, garamycin, vancomycin. And so what is it damaging here? Kidney. So you may get question in Nclex, your patient is taking garamycin and doctor has ordered the lab. What lab are you paying attention? Creatinine level. Are we clear? And what else do you do there? The blood test. What is the blood test is called? Peak and trough. Write down the word. You guys have done that. So remember the word peak and trough. What is peak means? After your antibiotic. Trough means before you start antibiotic. Are we clear? Peak means after and trough means before. Maybe third dose of your antibiotic. So when you're going to give third dose, after you finish, you draw the blood. Trough means before. We have done this many times. And if you don't remember, and you're going for a test, and they will throw the wording, patient is on garamycin, that's a lab question. So what test are you looking for? Creatinine level. What is a glucose, hemoglobin normal? 7.5 or less. If it is 6, wonderful. But now it used to be up till 4 to 6, but now they're considering 7.5 normal. Then you will have CK, creatinine kinase, troponin, and also they're saying troponin I and T. CK, where you have word, write down the word CKMB or CKMM. That is all your blood test done for which patient? Heart attack. MI. You got to know. What is the word is called? Cardiac enzyme. I want you to write down. These are cardiac enzyme. You got to have a knowledge. What is high in your patient? When they have a heart attack, cardiac enzyme goes higher. So these are your lab. Erythrocyte study. What is erythrocyte? I want you to write down the word ESR. Erythrocyte segmentation rate. I have done this. Which patient I told you? You must know. ESR, inflammation. Why do you do? To know inflammation. Which patient inflammation goes high? I want you to write down is rheumatic fever, glomerular nephritis, very important. Rheumatoid arthritis. Well, very important this lab, they give you for 3 diseases. Rheumatoid arthritis, glomerular nephritis in children, and also you are looking for inflammation. Are we clear? And so those are very important. You got to recognize. What are you checking with ESR? It's called erythrocyte segmentation rate, and you're checking the inflammatory process. Are we clear? So inflammation. And these are inflammation disease. Iron, we got to know normal iron. RBC, you got to know. Theophylline level, 10 to 20. So your Tylenol, your Dilantin, and your theophylline all are 10, 20 normal level. And so that's your patient with, what is theophylline? What is theophylline? It's a bronchodilator for patient with asthma, patient with pneumonia, all your breathing problem patients. What are you giving? Bronchodilator. Are we clear? I want you to write down side effect of bronchodilator. We all should know. Palpitation, nervousness, tachycardia. What do you teach patient? Not to drink coffee, any stimulant. Why? Because it increases. And very important, before you start theophylline level and Theodore medication, check if patient has any thyroid problem. Because remember, hyperthyroid, they already have tachycardia and a cardiac problem. So these are good. Now underneath it says motor development. We got to know normal growth and development in the child. And chin up by 2 months. Push up and swim, 6 months. Sit alone came a lot of time in exam with help by 7 months. Crawling, 8 months. Standing by holding, 10 months. They can walk is 11, stand alone 14 months, walk alone 15 months. Very important, your motor development. How does their muscles are growing and what can they do it. Now, playground anxiety level. Now, these are when they are stranger anxiety. Is very common in toddler, but it runs till 1 year. Separation anxiety in toddler. Stranger anxiety start early by 6 months, and they're still with the stranger. Parallel play, 2 to 3 years. That is toddler. And group play, 3 to 4 years, more like a preschool. They're getting a little bit there. Everyone should know your psychological growth and development. Now, when you're taking tests, you've got to know these things. As number 1, Erickson Theory for infant, toddler, you have an age group, a trust versus mistrust, autonomy, initiative goes in a preschool, school age, industrial. Now, these goes all your growth and development. But look at second one, is psychologist. One is Erickson. Erickson Theory is this. What is Freud theory is oral, anal, phallic, latency, and genital. So they might give you the wording and they say, who has this theory? That is another scientist. Piaget is with sensorial and also pre-operational, and also you will go concrete and formal operation. So those are your growth and development. I think someone is looking for you. And lab values are your sodium, potassium, calcium, are all these your labs are. And then you will go coagulation study, partial thromboplastin, all that we already talked about it. Bleeding and clotting, it's repeat. Serum test is very important, we already talked about it. And cholesterol, uric acid, so it's a repeat which we have done. Whatever you know, whatever you can memorize, I'll advise you to know for your testing those things. Now, next page, you're going to go on glucose study. You do 70 to 105 is considered for fasting glucose. Capillary glucose monitor when you're doing is, fasting is a little different than what you do yourself with the Accu-Check, is 60 to 110. Renal function test, very important for your Nclex, creatinine, and I told you for your drug. Erythrocyte, this is very, very important. If you don't know your normal hemoglobin, hematocrit, very important. Hematocrit, they throw a lot. And remember, increase in hemo concentration, fluid loss and dehydration. So whenever you are dehydrated, your hematocrit will be high. And when you are over fluid, then your hematocrit level would be low. Decrease in fluid retention, highlight that word, and write down the word also hypoxia. Whenever you have hypoxia, your hematocrit would be up. So remember, your hypoxia and dehydration. Everyone should know your normal level of hematocrit because that is important for assessment for your red blood cell. And red blood cell, white blood cell, you all know. Phenylalanine level. Where did we do phenylalanine level? Where did we do phenylalanine level? In babies. And what is the test is called? PKU. Very good. Write down the word PKU. And what happens if it is more than 2? Babies are going to be with phenylketonuria. And what would it lead to? What would it lead to? Mental retardation. What blood test do we do? What is the name of the blood test? Guthrie test. Everyone, we talked about it. Make sure we all know. And also PKU we said. Now next is your cranial nerve. We have done in the last package. And cranial nerve for your eyes. Our cranial nerve 2, very important. Patient is admitted with cranial nerve 2 damage. What are you be looking for? Fall, prevention from fall. Eye movement 3 and your 4 and 6. Trigeminal with where? 5. Face 7 is facial and 8 acoustic for hearing. Last one, 12, is for your tongue movement. 12. And also is your 9 and 10 will go with your gag and swallow reflexes. Very important, we all know something about cranial nerve. Are we okay? And so you guys have here. I will move on ABG. You need to know ABG. And I'm going to talk about, when I do the next packet, little bit acidosis, alkalosis. Are we clear? And what is it in ABG? Your pH level. What is PCO2 normal? Carbon dioxide. And when you have CO2 is more 35 to 45, you have to pay attention. It's a breathing problem. Are we clear? CO2 level is high. Oxygen level is for your PO2, 80 to 100. Your oxygen level is low. What is the word we'll call? Hypoxia. Are we clear? And those are your questions. And oxygen level, you're looking in respiratory. CO2 level, you're looking in respiratory, acidosis, alkalosis, and pH. O2 saturation, 96 to 100 is considered normal. If they give you 94 to 95, you still give oxygen. Are we clear in your question? So make sure we all know. Glasgow Coma scale, we already talked about it. Glasgow Coma scale, normal till 15. Below 8 would be positive. And what are you looking? Eye, motor, and verbal. What assessment are you doing? What assessment? Neurological. What are you assessing? Patient is responding or not responding. Are we clear? Coma patient. Now, autonomic nervous system effect on your heart, your lungs, your GI, your rectum, your bladder, erection, and remember, underline the word adrenergic and cholinergic. Adrenergic means they are increasing, they are dilating, they are allow filling. But what is cholinergic are? Decreasing the heart rate and causing constriction, causing emptying rectum, emptying bladder. So when you want adrenergic, it allows to prevent them, is your pink. That means allow to keep the bladder full. Cholinergic means they will empty and maintain erection. So those are in your nervous system, some of the wording, which is good. We all should know that. Next page, I will move on, is on your continuing adrenergic is with the eye and also ejaculation word and also the blood vessel, constricting and dilating. Now we all should know a little bit about the heart. What side of the heart you have, it says how does the blood fills in. Now what is the oxygenated blood and deoxygenated blood? Everyone remember, where is your deoxygenated blood? Where is your deoxygenated blood? In the, what side? The right side. Where is oxygenated blood? Left side. So write down deoxygenated blood is on the right side. How do you get the blood on the right side? That start from the beginning. Inferior vena cava and superior vena cava. So your superior, inferior vena cava bringing deoxygenated blood where? Where does the blood goes here? In the right atrium, and from where? Superior and inferior vena cava. Are we clear? So how do you get the blood from superior and inferior vena cava to the right atrium? Now where does the blood has to go from right atrium to where? Right ventricle. Are we clear? So right atrium, and after right atrium, the blood has to go right ventricle. But what do you have between the right atrium and right ventricle? What valve do you have? Tricuspid valve. Remember, tricuspid valve. And then in the right ventricle, what do you have? Pulmonary artery. So it says right ventricle and pulmonic valve in the pulmonary artery, and it goes the blood to the lungs. Are we clear? And then from the lungs, how do you get the blood back to the left ventricle? Underline the word by pulmonary vein. So how do you get the blood back to the left ventricle? By pulmonary veins. And also, where does the blood come back in the oxygenated blood? where do you get oxygenated blood is the left atrium. Everyone is okay? Left atrium. You can give him the package. Left atrium. And what is in the left atrium? We are in the way back. You can help him. And left atrium. And what is in the left atrium? The blood has to go into left ventricle. What is in between left atrium and left ventricle? Do you have? Mitral valve. Are we clear? So mitral valve open, the blood flows into left ventricle. What is in the left ventricle do you have when you get oxygenated blood? Here is the aorta. Are we clear? Where is aorta supplies? Aorta supplies the blood throughout the body. And that is your aorta. And which disease your mitral valves are affected? Which disease your mitral valves are affected in the left ventricle? Rheumatic fever. Write down the word rheumatic fever. Your question. Where is the rheumatic fever damages? Mitral valve. Endocarditis. When your valves are bad, disease is called endocarditis. Rheumatic heart disease. It's not a simple your problem with rheumatic fever. What are we damaging here is the valve. What do you do in your question in cardiac if they're saying rheumatic fever, rheumatic heart disease, and write down the word endocarditis. They're bad. Why? Because your valves are affected. What is endocarditis? Inside the heart, what do we have? The valves. And what is the valve does? They open it up and allow the blood to go. So what happens if your blood is not flowing? What happens if you're not getting blood throughout your body? Can you work? Can you do anything? No. So what is your first answer? You are admitting a patient with rheumatic fever or endocarditis. What do you do as a nurse? What do you do as a nurse? Can you do anything? Allow your patient to rest. And what do you do? Activities in between rest. What is the meaning? Activities. These are your questions. Understanding the word. Activities in between rest. Let your patient rest. You want to give bathe. You want to do the bed making. Don't do in one time. You do your bed, let your patient rest, then you go back after 1 hour, then you bathe. Why? Whenever your heart is bad, you're not getting circulation and you're not going to do anything. They gave you a question, patient has rheumatic fever, what do? They are thinking you should already know what happened to the patient with rheumatic fever. The heart has been damaged. How do you get rheumatic fever? Streptococcal infection or sore throat. So before child is admitted with rheumatic fever, what is the history of the patient here is a sore throat. Are we okay? So sore throat, rheumatic fever. See how you got to connect? Valves. Valves are very important. If your valves are not, what is the function of the valves? They open and they close. And when the blood goes down, they closes. What will happen if they don't close? There is a mixing of the blood. And what happens if the valves are not able to open and close? Your blood is not flowing. So it's important. Now there is remember in the cardiac, we have pericardium, myocardium, endocardium. When you have endocarditis, it's the worst because your valve. When you have pericardium, is infection. You can treat them. What happened in the middle layer, myocardium is dead. You have angina and heart attack. What is myocardium? Is the middle muscle of the heart. And what is the middle muscle of the heart does? It pumps the blood. Are we clear? Your muscles are damaged. Your blood is not flowing. So we all remember in the cardiac question, endocarditis word is not good. You got to give patient bed rest. And how do you treat them? By IV antibiotic. Make sure you know. Your patient is going home with IV antibiotic for longer time because they have to live with. Same thing with rheumatic fever. You give them rest, give them antibiotic, and prevent them from further infection. Are we clear? And so what can be? Maybe a tonsils infection, maybe sore throat, any upper respiratory infection leading to that infection. So we all should know which side is your deoxygenated blood is on the right side. Which side your oxygenated blood is on the left side. What is the main valve is important in the left side is your mitral valve. And what is the blood is supplied throughout the body from where? From aorta. Are we clear? So what happens if you don't get the blood? And lot of all your cardiac question, CHF, MI. What part of the heart is damaged? Left ventricle. What part of the heart is damaged when your heart is getting bad? Left ventricle. What is left ventricle? Left ventricle is supplying the blood throughout the body. So in your question, patient has MI. What part of the heart is damaged? Left ventricle. Patient has MI. What part of the heart is damaged? Left ventricle. Pulmonary edema, same thing, because the left ventricle is supplying the blood throughout the body. So that is important. In your main pacemaker is your cardiac impulses underneath. Where is your main is pacemaker? It's called SA nodes is your main pacemaker. Where is SA nodes are? Underline the word right side of the atria. Right side of the heart in the atrium. So SA nodes are in the right side of the heart. So where is your main pacemaker? On the right side of the heart. And then where do you have? So everyone remember, if they throw the word, how does your pacemaker work? Your answer would be SA nodes. And SA nodes are sending impulses to AV nodes. And where is the AV nodes are? It's still in atrial, is in the atrium, called atrial septum. They use the word septum. Septum means between both the atrium. So it's right here. And now this is the heart, and this is right, and the left side right here. So you have another AV nodes. Then it moves, is called bundle of His and Purkinje fiber. So then you have atrial ventricle, SA nodes, AV nodes, and bundle of His moving to the ventricle, and it divides on the right and left, and these are the Purkinje fibers. So everyone remember few wording. Where is your main pacemaker? On the right side. Are we clear? Right atrium. And how does your pacemaker works? Then you will answer SA nodes, AV nodes, and then you have bundle of His and the Purkinje fiber. Are we clear? So those are very important on your heart. Blood volume is 500 ml. Venous pressure. You guys have capillary refill time. We all should know capillary refill time. When do you monitor capillary refill time? For dehydration. Circulation question. Dehydration question, very important. You monitor. Sweat level. Where do you monitor sweat level? For the babies with cystic fibrosis. And they lose a lot of salt. And when do you measure? Write down cystic fibrosis babies. And it will be more they're losing. Ocular pressure, we already did. PCWP is your next one is capillary wedge pressure. Normal output of the heart. Cardiac output would be 4 to 8 liter. Now you guys have a lot of level here. Now I don't know if you can remember all of them, but some of them you should know. Like lithium you should know. And we have talked about linoxin, you should know, theophylline, you should know, magnesium sulfate, phenobarbital, and dilantin, you should know. Those are common drugs are there. So you go through that, a lot of the things we have done already, so remember that. Capillary wedge pressure, you have pulmonary artery, spinal pressure for lumbar puncture, 70 to 200. Morphine sulfate dose for the pills in there, they have given here. Sulfonylurea word. What is sulfonylurea? Is a diabetic oral medication. Write down oral diabetic. Gluburide and tolabutamide. Those are your medication you are giving oral for patients. So monitor for hypoglycemia, and side effect of your oral diabetic medications are diarrhea. and rashes. Write down diarrhea and rashes. Now, next page you guys have is a few things left before I take a break. So I'll finish this one. It's your calculation. You all should look through. Next page, you have Fahrenheit to centigrade, centigrade to Fahrenheit, formula calculating medication, formula IV. Immunization, very, very important. And they have asked hepatitis. They have asked oral polio, DPT, HIV. What is HIV? Influenza vaccine. That should be given 2 months of age. HIV is influenza vaccine. 12 to 15 months, you must give MMR, coming in exam. We have done in the other pages. How do you give MMR? They have asked in the test, sub-Q. What do you monitor allergies with MMR? Neomycin. Neomycin for MMR and sorbitol, allergies, and you give sub-Q, 12 to 15 months of age. And then you have also MMR 11 to 12. If not, then you give 4 to 6 years. If they did not get that time, you must give in 6 to 8 years. Are we clear? So I want everyone, please memorize your immunization. And also, we have talked about spinal cord injury. On the next side of the page, we are finishing the second page. And on this page is very important. What do you remember is C2 and C3. What does C means? Cervical, neck. Write down C2 and C3 is neck. When they're saying C4, underline the word diaphragm. And a diaphragm is here between the breathing. C4, respiratory and paralysis for extremity. Upper and lower, very important, your question. C4 is affecting, we are almost in the last page. C4, you're going to go for breathing and also paralysis. Are we clear? Cervical injury. Thoracic injury, remember, thoracic is your back, is affecting bowel and bladder and leg. Paraplegia, very important, I told you, autonomic dysreflexia. What is autonomic dysreflexia? Highlight that word and write down there, hypertension. Their blood pressure goes high. Why? Underline the word, because of bladder distension, impacted rectum. They are sweating, hypertension, nasal stuffiness, and goose flesh. I want you to write down the word piloerection. They throw this word in your question. Piloerection. That means goose flesh. And remember, whenever you see this word, is called noxious stimulation. Noxious stimulation. Sometimes they use the wording. Noxious stimulation means something is bothering you and anything is not able to move. Noxious stimulation means your nervous system is getting stimulation of pain, and your pain is increasing your blood pressure. Your patient did not pee because they're paralyzed. Patient could not pass the BM, the blood pressure goes very high. Very important, autonomic dysreflexia is a complication of a spinal cord injury. What do you do as a nurse? First thing, remember your answer would be the blood pressure. So what do you do to lower the blood pressure? Write down, raise the head of the bed. Then second thing, make your patient comfortable. Anything, cold, air, clothing, loose clothing, positioning. And then you check bladder, check if they have peeing. There is no bladder distension. Next, check for impaction. Don't call the doctor right away. You've got to do the thing, and that's what they're checking in autonomic dysreflexia. What do you do? Lower the blood pressure, check the bladder, check the BM, make sure your patient is comfortable, then you call the doctor. Are we clear? And then call the doctor and give blood pressure medication. And last thing, you will document. So remember, your questions are all that apply. You got to move on with first priority. Are we clear? So everyone, very important, if you have C4, cervical, paralysis, 4 extremity. If you have thoracic lumbar, your whole lower part of the body is paralyzed. And what are you remember, your patient with spinal cord injury, they are what? What kind of patients they are? Back injury, right? Spinal cord injury. How do you turn them with spinal cord injury? Log rolling. All your question with log rolling, autonomic dysreflexia. Rule of 9, your one question, we all should know. Next is white blood count. White blood count is your neutrophil. When they say neutropenia, that's your neutrophils is high. Eosinophil, basophil, lymphocytes, and monocyte. Thyroid study. Thyroid level, you all should know, last page, is your TSH and T3 and T4. Tridothyroxine, T3 and T4. Now remember, when you are hypo, your thyroxine level is low, T3 and T4. But what is high here is TSH. So I want everyone write down on the side, if you will remember like that. In hypo patient, mixed edema patients are low T3 and T4. And what is high? TSH. Hyper patient, you will have high T3 and high T4 and low TSH. Remember, as this increasing, your doctor need to increase the synthroid medication. That's why they're very based on TSH level for hypothyroid. Hypo means they have low thyroxine, thyroid hormone. So everyone should remember thyroid is important, and we already talked about is on your patient here is a lot of lab, we already covered. Herbal medication, these are the listing. We did the common one earlier, so you can go through and start memorizing. Then at the last page, you have 4 strategies for answering your question. If the patient asks, why should you do in this situation, use nursing process. So you use your nursing process for your answering your question. Assessment, that comes first. If question asks, client's need. And so first thing, underline the word nursing process. When you are answering what do you do for your patient, then you go Maslow's theory. And you go from the basic one. And number 3, if the question indicate client does not have urgent physiological need, safety. If question involve communication, underline therapeutic communication. So when you're answering your questions, number 1, your assessment, number 2, your Maslow, number 3, ABC, and number 4, communication. We are treating our patient by our communication skill. Remember, airway, breathing first it comes. And the last question on this page, you have the nurse in a primary care clinic, 50 years old woman, history revealed experience on chest pain. After series of EKG, the doctor ordered, underline the word thallium stress test. They use the word thallium stress test. We do for cardiac patient. And following medication. So when your patient is going for word thallium stress test, what is stress test? When you are exercising, you're going on a treadmill. But some patients that can do it, and if they have cardiac problem, they give them, they use the word thallium stress test. So remember, what is in the stress test, what medication before your patient is doing, and you prepare. Number 4 is your answer, presenting. And sometimes they say that what is a presentage test is, always remember stress test. Are we clear? Which patient why do you give presenting? It's a open up the coronary artery so they can exercise. What happens when they're exercising, they can have chest pain. So they give presenting and also for improving perfusion to the heart. And when they have CAD word, coronary artery disease, and they will feel chest pain. So before they go on a stress test, what do they give them? Medication, presenting. It's a stress test. What do you teach patient when they're going on stress test? Is no smoking, and also cut down their medication like a blood pressure medication. Why? Because it drops the blood pressure and they feel dizziness. So everyone smoking, coffee you avoid before the test, and also your blood pressure medication. A stress test and cardiac catheterization, everyone should know for your cardiac patients are. What do you monitor after? Write down underneath cardiac catheterization. Patient is going, that's two procedure is important. Cardiac catheterization, they put the catheter. And where do they put it? From antecubital or femoral. So post-op care, monitor for bleeding. And what do you, and tell the patient not to bend their arm, keep extension. Keep the extremity extension, because if they bend flexion, they can bleed. And for bleeding, you can use sandbag. They can say the word sandbag, and also maybe applying the pressure. So what do you monitor? Number one, bleeding. What is number two? You monitor cardiac cath patients are, write down the word peripheral pulse. Pedal pulse. You want to go away from the heart and check their pedal pulse. Are we clear? So what are you checking your patient after cardiac catheterization? Very important. Monitor for bleeding and monitor for also for peripheral pulses. Are we clear? So I'm going to stop here. We finish this package and let's take a break for 10 minutes. All right?